Some patients tell me something very frustrating. They say, "Doctor, I keep seeing blood in my urine. I have done all the tests." Normal tests do not mean the symptom is imaginary. They also do not automatically mean something dangerous is being missed. When major tests are normal, recurrent blood in urine with normal test, what it really means. Some patients tell me something very frustrating. They say, "Doctor, I keep seeing blood in my urine. I have done all the tests. The ultrasound is normal, the CT is normal, the cystoscopy is normal, and yet the blood keeps coming back." This situation is confusing and scary as well. Patients start wondering, are doctors missing something? Is this cancer hiding? And will this suddenly turn serious? So in this video, I'll explain what recurrent blood in urine with normal test means, why it happens, what conditions can cause it, how doctors think through these cases, and when reassurance is safe, and when the follow-up is important. The most important thing to understand is normal tests do not mean the symptom is imaginary. They also do not automatically mean something dangerous is being missed. When major tests are normal, it often tells us life-threatening causes are unlikely, cancer has largely been ruled out, and the bleeding source may be subtle, functional, or intermittent. This is a position of reassurance with awareness, not dismissal. So what normal tests actually rule out? When we say the tests are normal, it usually means no kidney tumor on imaging, no bladder tumors on cystoscopy, no large stones, and no obvious structural abnormality. This test rule out the most dangerous causes of hematuria, or what we call blood in urine. That is extremely important and reassuring. The question then comes, what causes bleeding when major problems are ruled out? Now, intermittent bleeding, why a test can miss it? One reason recurrent hematuria is confusing is because bleeding can be intermittent. Bleeding may occur for a few hours. It may stop on its own, leave no visible trace by the time tests are done. This does not mean tests are wrong. It means the source may be small, self-limited, or pressure related. Common benign causes of recurrent hematuria with normal test. When serious causes are ruled out, the common explanation include small stones or crystals not always visible, fragile bladder or urethral blood vessels. It could be prostate related bleeding in men. Sometimes it's exercise induced hematuria, mild inflammatory conditions, or a blood vessel congestion in the urinary tract. These causes can bleed occasionally and stop spontaneously. Now, talking about prostate as a common source in men. In men over 40, prostate is a frequent source of intermittent bleeding. A large prostate can cause fragile surface blood vessels which bleed after strain, constipation, or exertion, mostly at the beginning or end of the urination. These bleeding looks alarming but usually is benign and often comes and goes. Importantly, the prostate-related bleeding can occur even when the PSA and imaging are normal. Talking about bladder, the bladder lining contains many small blood vessels. In some patients, these vessels become fragile and even a minor irritation causes bleeding. Usually there is no tumor or stone. This can be seen most commonly with bladder inflammation, post-radiation changes, or a long-standing irritation, and sometimes a condition called bladder pain syndrome. Cystoscopy may appear normal in between the episodes. Now, talking about exercise-induced or pressure-related hematuria. Strenuous physical activity can cause temporary hematuria. This can happen due to repeated bladder wall impact, dehydration, and increased abdominal pressure. Typically, the blood appears after exertion. It resolves within 1 to 2 days and does not indicate any disease. However, the confirmation of resolution is always important. Now, there is a special category called microscopic hematuria. Some patients never see blood with the naked eye. The blood is detected only in urine test. This is called microscopic hematuria and can persist for years without progression. In many cases, no cause is ever found, the kidney function remains normal, and no serious disease is developed. These conditions or these patients are monitored and not treated aggressively. Now, when the normal tests are actually good news. So when should I say the normal tests are actually good? It is important to say this clearly. Normal CT and normal cystoscopy are very powerful tests. When these are normal, the risk of missed cancer is very low and immediate danger is unlikely. Watchful follow is often the safest strategy. Sometimes retesting everything repeatedly does not always add value. What doctors do in recurrent but unexplained cases. When hematuria recurs but the tests are normal, we usually review all previous reports carefully, look for the pattern, the timing, the triggers. We monitor frequency and severity and do repeat evaluation only if something changes. Medicine here is about trend observation, not constant intervention. Now, the most important thing is when to re-evaluate. Even with normal tests, re-evaluation is sometimes needed, especially if the blood becomes more frequent, if the clots appear, if pain develops, if there is a weight loss unexplained, if there is change in urine flow, or if the new symptoms appear. Normal tests today do not mean lifetime immunity. They mean current reassurance. Now, what should patient not do in this situation? In this situation, patient should avoid being repeated panic, demanding unnecessary scans, ignoring doctors' follow-up advice, self-medicating, and assuming doctors are missing cancer. Fear leads to exhaustion, not answer. So my take-home message is, the most important message in this is, recurrent blood in urine with normal test is usually not dangerous, but is not meaningless either. It tells us serious causes have been ruled out, the source is likely benign or intermittent, and monitoring is safer than being panic. Normal tests are not failure, they are protection. With proper follow-up, awareness of warning sign, and a calm approach, patient can live confidently without constant fear. Clarity replaces anxiety, understanding replaces panic, and reassurance becomes possible. Thank you for watching this video. If you find this video helpful, kindly share it with someone who needs it.